Hi, I'm Abokora. For today, we are going to discuss on visual acuity. As you all know, the visual acuity plays an important role in the field of optometry. As an optometrist, the basic step to ascertain the state of eye is by vision through visual acuity. And the visual acuity is the measurement of the ability of eye to determine or to distinguish between the size and details of an object at a given distance. Visual acuity in terms of visual angle is defined as the reciprocal of minimum resolvable visual angle measured in minutes of arc for a standard test pattern. And for individual patient or a person to see a letters clearly and correctly, he must have the 5 minutes of arc as the minimum resolvable visual angle. And the visual angle is the angle subtended at the nodal point of eye. Nodal point of eye is the center of crystalline lens. Visual acuity chart. There are several visual acuity charts that are used in measurement of vision based on age, distance. For the age is also divided into, that means the measurement of visual acuity based on age is subdivided into infant, 2 to 3 years, 3 to 5 years, and for adult. And for distance is subdivided into 2, for near and for distance. For the near we use 33 centimeter, while for the distant we use 6 meter. And now we are going to discuss on distant type and chart that are used in it. The distant chart include Snellen Test type, Land.C, illiterate equal out, arrow, and broken wheel. The Snellen Test type is the most employed and practiced chart that are used for the measurement of visual acuity. And the Snellen Test type, it consists of series of black letters that are arranged in whiteboard, which are progressively diminishing in size. Each letter is designed to fit in a square, and the vision is recorded as 6 by 60, 6 by 36, 6 by 24, 6 by 12, 6 by 9, and 6 by 6. Procedure for testing. Ask the patient to sit at a distance of 6 meters to read the chart, each eye separately. That means by occluding the one eye. Patient who is able to read up to 6 lines correctly is recorded as 6 by 6. Depending upon the smallest line the patient read, his or her vision is recorded. Patient who cannot able to read the topmost letter or the number at a distance of 6 meters, the vision is recorded as 5 by 60, 4 by 60, 3 by 60, 2 by 60, and 1 by 60. That means the distance is recorded by 1 from 6 meter distance to 4 meter distance to 3 meter distance and to 2 meter distance. Unable to read the top line even at a distance of 1 meter, he or she asks for finger count, and the vision is recorded as finger count 3, finger count at the distance of 2 meter, finger count at the distance of 1 meter, and finger count closest to the face. And likewise, if the patient also is unable to appreciate finger count, then now you will switch to hand movement by moving or waving the hand to the patient face, and the vision is recorded as hand movement positive or hand movement negative, depend upon the answer received by the patient. If he perceives or appreciates the hand movement, then his vision is recorded as hand movement positive. But if he can't appreciate the hand movement, his vision is recorded as hand movement negative. The next is perception of light. If the patient can't appreciate hand movement, then light is thrown into his face by the use of torchlight or any light sources, and ask the patient if he or she perceives the light, and the vision is recorded as also positive and negative. Perception of light positive and perception of light negative. These are the steps for visual acuity tests. Thank you.